quad set. So I just took some hand towels, 2 of them to be exact, put them on top of each other, and then I'm simply just gonna roll them into each other. So this is one of our drills that we use if someone's coming off of a knee surgery, someone has some sort of acute injury, and there's some irritability in the joint. So if you look down at your joint and you notice that left compared to right, there's a difference on the side that's involved in terms of this swelling, that's pretty normal. So the correct term is going to be a fusion, which means that the joint is kind of swelling from the inside out. So if you have a fusion, you go to do this drill, you're going to feel some pressure under the kneecap, and you're almost going to feel like there's kind of like the analogy that I often use is if you took a t-shirt and you stuck it in a door hinge and then you tried to close a door, there's like this kind of give in the door, but the door doesn't close all the way. And that's oftentimes people will feel. So just keep that in mind. Everyone's gonna be a little bit different, with what type of injury you are, if you're post-surgical, or if you're coming off of some sort of like acute injury. So when you get set up, I like to do these with my feet about halfway off of a surface. So I'm using a training table here. At home, this could look like using the couch, an ottoman, the bed, whatever it may be. But then you're gonna put a towel under your knee. So when you get set up, I have the table here, probably 2/3 of the way down my shin. And I like to do these seated. So typically what happens is people's quad will get weak, and then you get a little bit of like an inhibition, meaning your nervous system is not gonna fire as well or as efficient to get this quadricep muscle to fire. So when people do it laying down, which is what is prescribed often, you'll see them really squeeze their butt, and then they're trying to go into hip extension. So if I squeeze my butt and I drive down with my butt muscle, I'm actually not firing my quad, and I can still get a little bit of a quad set through the compensation pattern. So if I'm seated upright, it's a little bit harder for me to be able to use my glute, and then I can actually see my thigh firing, and I can watch my foot. Because the point of emphasis here is to keep your foot entirely relaxed, drive the back of your knee down into those towels, and then straighten your knee out all the way. The ultimate goal is to go into hyperextension, which if you look at the ankle bone here, it's higher than the knee joint, which means I'm going into hyperextension. But most people are going to be unable to do that at first. So the most common prescription is going to be 10-second holds 10 times. So what that would look like is I'm going to drive my knee down into the towel roll, get into extension, feel the quad work, and I'm going to hold that for 10 seconds. A lot of people will pull the toe up, and they'll feel an increased stretch and pressure in the knee joint when they do that due to the calf muscles that cross the knee joint. So again, do your best to relax your foot. And the only place that you should really be feeling work is that quad right around the knee.